This is the drill sequence for CeraRoot 34, starting with initial drill 2.3, 2.8, 3.5, and then countersink either 14 or 34 with orange color or violet color. We can use the initial drill to make a mark on the crest of the bone where we think it's the center of the implant placement. So we are going to use this drill to check the direction of the drilling and make sure we are always inside bone structure. The drill depths are 6, 8, 10, 12, 14 and 16. It's good if you can drill 2 extra millimeters than your implant length. So if you're planning to place a 10 millimeter implant, it's good if you can drill almost 2 more millimeters, so you can adjust more where you want the margin of the implant. Sometimes you want to place the implant deeper because the gum has some recession. With the initial drill, you can check the direction of your drilling, so if something has to be corrected, it's the right drill to make all the adjustments. So it's good not to go with the next diameter until you have good inclination of the drill and then also good position in the crest of the bone. In this case, the drilling was done, and then when we place the drill, we can see that it's not facing buccal too much, so we have to drill again and pushing more to the buccal so that the inclination of the drill is more parallel to the canine cusp and the fossa of the premolar. So we want to place the implant more or less in the line between the cusp of the canine and the fossa of the second premolar. So once we have the drilling direction corrected, we can go with the next diameter, which is 2.3. Same depths, 6, 8, 10, 12, 14, 16. So we're drilling to 12 millimeters to place a 10 millimeter implant. If you have the sinus, you have to drill to the sinus floor and then do a sinus bump. So every time check the direction of the drill and see if you are following the same incisal edge of the canine and the fossa of the premolar. If you are in line, then this is the right implant direction. So we go with the next drill. Next drill is 2.8. It's good to check the inclination of the drill before going to the next drill. So now we are using the 3.5 drill. This is going to be the last cylindrical drill. We can drill at a very slow speed, and we can even collect bone particles and use them if we have a thread of an implant exposed. So very slow speed, no irrigation if you want, or between 800 and 1200 RPM. So once you have the 3.5 in the correct inclination, then it's time to go with the countersink. The countersink has two marks, one thin laser mark which corresponds to the coronal thread and one thick line which corresponds to the implant shoulder. So the placement of the countersink has to be between the two lines, so you have to leave the bone, the crest of the bone, between the two lines. That way you will be able to submerge the implant a little bit if you want to. So lots of irrigation, 800 RPM, and just drill vertical inside the socket. Sometimes you need drill extender because the contraangle hits the neighboring teeth. So remove the countersink from the contraangle, place it into the mouth and see how the countersink looks like. If you see the thick laser line supragingival, you can drill deeper, so you can control more of the shoulder. You have 4 different lengths for the premolar, 8, 10, 12, 14, and you also have short or long abutment. Short abutment will be most of the heel sides. When you do immediate extractions, and sometimes you need to engage deeper bone to get more stability, sometimes you need longer abutment just in case the implant has to go in deeper, so you can have much more structure to cement the future crown. So this is the box comes with short or long abutment. So we open the box, and inside the box we find a blister which is sterile, and you can bring the implant directly into the mouth of the patient. As soon as the implant is stable inside the socket, you keep twisting the silicone and it will come off. If you push down too much, the silicone is gonna get stuck in the abutment and it's gonna be more difficult. So just start spinning and it will come off. If the cap comes off, just keep spinning on the purple tube, silicone tube, and you will see that it's gonna come out easy. The transporter 34 has a vertical line on the outside which indicates where the flat wall of the abutment is, so you have to match that vertical line on the driver with the flat wall on the abutment. Inside the driver there's a flat wall which corresponds to the flat wall of the abutment. So once the transporter fits deep into the abutment, you can bring the thumb wheel and start screwing the implant by hand until you reach enough newtons, and then you will use the torque wrench. The torque wrench has 2 positions to insert, to screw in or screw out. So we're gonna push down the implant so we avoid the implant spinning on the same place. So push down and check the torque of the implant, so you don't want to exceed 35 newtons. If you're doing immediate extractions, it's more important to press down so that the implant is following the extraction or your drilling direction. You can also use the right angle adapter if you want to place the implant with the motor. So you will use the right angle adapter in combination with the transporter 34. So both devices have to be connected together, and then you should place maximum torque of 35 newtons and speed of 50 or 75 RPM. When the implant reaches the maximum torque, we can check with the wrench if we have the implant in the right direction. So sometimes you want to leave the flat wall on the abutment facing buccally because you need more space for the crown, but sometimes you can leave also the flat wall on the abutment facing a tooth, so you have more crown space to make. So the flat wall does not necessarily have to be facing buccally always. When we apply a lot of pressure vertically, sometimes the driver gets stuck on the abutment, so use the thumb wheel to vibrate the transporter and the driver always comes off. So if the implant becomes too much supracrestal or you need more space for the crown, you should unscrew the implant and make the osteotomy wider, otherwise you will exceed 35 newtons of torque. So once you have removed the implant, use the last drill called countersink and drill in the same direction, just a little bit deeper, so you are able to have a bigger osteotomy and the implant will be able to go down with less torque. So after the drilling, you can see how deep it goes. We use the wrench again to place the implant, and we control the vertical line on the driver so we can place the flat wall in the position where we want. If we want it buccally, we leave the line on the driver facing buccally, and we check that the shoulder, prosthetic shoulder, is far away from the bone, so we have a healthy gingiva around the implant once the crown is cemented. So we check the torque and we are getting close to 35 newtons, and now we can finally remove the driver and see that the implant went down about 1 millimeter or 1.5 millimeters, and now we have much more space for the crown. So as long as the shoulder is enough far away from the bone, this is going to be a very healthy implant.